Hello, this is Dr. Irvin Sahni with Spine Center of Texas, and I would like to speak with you about anticoagulants, specifically in reference to when you're having a procedure in the office. It's very important that you make us aware of any anticoagulants that you're taking prior to your procedure. Anticoagulants can be prescriptions, but they can also be foods or other herbal medications that you're taking over the counter. And it's important to be aware of which medications, foods, or substances can thin your blood. This is especially important when you're having a procedure that's around or near the spine. The reason is that when we stick the needle near your nerves or near your dura, we can encounter veins, specifically epidural veins, and these can be punctured. If your blood is normal with a normal bleeding time and the needle crosses into the vein, that vein will clot and there won't be any issue. However, in cases where your blood is thinned either from medications or for other reasons, the blood can then leak out, and because it's thinned or its ability to clot or coagulate has been diminished, that blood can create what's called a hematoma. Inside the canal, you have to think of it like a pipe. It's a stiff pipe with stiff walls. And so there's only so much room in that canal. Typically, it's filled with nerves and cerebral spinal fluid. But now if you have blood entering that canal inside the pipe, it squeezes the nerves, and it can actually cause a very severe problem called cauda equina syndrome. Cauda equina syndrome can put pressure on the nerves and actually completely paralyze a person. This is extremely rare. It happens very, very infrequently. And in fact, even when people are on anticoagulants, most of the time this doesn't happen because the pressure inside the canal gets so high that the blood just simply can't leak out anymore. But in a patient with relatively high blood pressure and thin blood, this is a very real possibility. I have only encountered this, fortunately, one time in my practice. A neighboring pain physician had done a procedure in the cervical spine. This is where it can be very serious because the cervical spine can affect you anywhere from the neck down. That patient had an epidural steroid injection in their neck, and within 2 hours, the doctor who had performed it called me to let me know that the patient was complaining of rapidly diminishing strength in their arms and legs. Ultimately, we had to rush this patient to the operating room, which I was able to get the patient to the operating room within about 2 hours from the time of the injection, and open up their neck surgically and take all the blood out of their neck. Again, this is not to scare you, but this is to remind everyone that this really is a real possibility. It only happens maybe 1 in a million, but it certainly can happen, and therefore it's very important that we minimize this risk by managing it by getting you off of those anticoagulants. Every anticoagulant has its own profile. For instance, a very common anticoagulant that's been around for years is called Coumadin. Coumadin, or warfarin, thins the blood and is monitored by a blood test called a PTT, PT, and an INR. To keep it simple, the INR needs to be below a certain level prior to your procedure. For our office, the number that I choose is 1.5. A normal INR is less than 1.2. But anything over 1.5, I consider in most cases to be unacceptable, especially if the needle is going to enter right next to or has the potential of coming in contact with the nerves or the spinal cord. There are many, many prescription anticoagulant drugs, and you can get a list from our office. But every anticoagulant drug has a different profile. Again, Plavix is another common one for people who've had heart issues. That has to be stopped 7 days before we do the procedure. Lovenox, which is a subcutaneous injectable anticoagulant, only has to be stopped 24 hours before the procedure. So as you can see, the time frame that you have to stop the medication is specific to the anticoagulant itself. And there's so many of them that it really would not be worth trying to list all of them in this video. So be sure that if you know you're on a medication that's thinning your blood, that we're aware of that medication so that we can plan for the interval of time that that medication has to be stopped before you have your procedure. Another thing to note is that even foods or supplements can affect the thinning of your blood. For instance, a very common and very healthy thing to take is fish oil. I highly recommend that people take fish oil because it has a very favorable ratio of omega-3s in reference to omega-6s. So I certainly am not encouraging anyone to stop taking fish oil, but fish oil can thin your blood. And so it's important to stop that fish oil prior to having the procedure. Another commonly used supplement or vitamin is vitamin E. Vitamin E is a wonderful antioxidant and should be used in many cases to maintain appropriate health. But as fish oil does, vitamin E can thin your blood. And so you have to stop vitamin E typically 7 days before the procedure. Green tea, another common drink that many people like to utilize for its antioxidant potential, thins your blood. So green tea should be stopped approximately 7 days prior to the procedure. So if there's any question, we have a comprehensive list of common foods and prescriptions that can thin your blood. Please make sure that our office knows of any prescriptions, whether they be over the counter or from a doctor, or even some of these common foods that may be thinning your blood, so that we can take the appropriate action prior to your procedure. Thank you.